Dental implants work perfectly well. In fact, these are very successful long term, but 20% of patients approximately suffer peri-implant diseases, or basically what is called peri-implantitis. This means gum inflammation and bone loss around the implant. And this, of course, it progresses, it can have as a consequence the implant loss. It is very important to prevent peri-implantitis, having an excellent bacterial plaque control, oral hygiene around the implant, being adhered to a maintenance program in the clinic every 6 months, having the implants monitored, and having a proper implant brand placed and a hygienable, cleansable prosthesis over it. Patient need to be able to clean around the implants. If the peri-implantitis is settled, there are ways to treat it, particularly in the mild, moderate forms of peri-implantitis. If this is very advanced, sometimes the best treatment is to remove the implant and start over. But prevention is key not to have peri-implantitis.